Hello, good afternoon, and welcome to Ask Dr. Lulu. I'm so excited to be here this afternoon. How are you guys doing? Hi, my name is Dr. Lulu. I'm a board certified pediatrician. I'm a mom of two teenagers and one young adult. I'm a teen expert. Yes, I am. And I'm here to talk to you guys today about siblings of teens with depression. So if you're meeting me for the first time, I just give you my little intro spiel. If you've been here before, you know the drill. Take one moment. Okay, take two. Take 2 minutes and invite your friends. Anyone who is a teenager, anyone who knows a teenager. If you are a teenager yourself, if your neighbor is a teenager, you know it. If you're a grandmother of a teenager, the whole 9 yards. Anyone who you feel will benefit from this talk today, please invite them. So we are talking about teens and their siblings. So really about the siblings today, okay? Yes, so if you guys are ready, let's go. Oh yeah, don't forget to tell me where you're joining me from. Okay, I like to know where you're coming from. All right, thank you. Hi, Jenna. How are you? My first one today. Hey, Namdi, my son. Princess Adora, how are you? Diane Thompson, okay. Stacy Blackman, Brenda Caldwell, Anna Phillip, Amanata Suleiman. Oh my God, everyone is here. Oh my goodness. Hi, Jenna. Are you serious? You're one of my favorites at the West Campus. Oh, thank you. Thank you. Well, I'm going to get started. Now, don't forget to give me hearts and loves. I love them. Let's get started. Hi, Brenda Caldwell. Hello. Hi, Elise. Welcome, welcome, welcome. So today we're talking about siblings of teenagers who have depression. So I'm going to start by saying depression in a teenager does affect everyone in the family, okay? If you're just joining us for the first time, joining us now, we're talking, hi Brenda from Lancaster, yes. We're talking about siblings of teenagers who have depression. So it affects everyone in the family, the teenager and their siblings and their parents and the grandparents and the extended family. It does affect pretty much everyone in the family. So it leads to conflicts sometimes, disruption sometimes. We're going to use a family today to kind of illustrate the story. But before I do that, I wanted to mention that teens, so there was a study that was done that showed that teens aged 13 to 18 years of age, they found that 49.5% of those teens who were polled admitted to having one form of mental health disorder or the other. That is very powerful. So we're talking about teens aged 13 to 18, 49.5%. Can someone please write 49.5%? For me, 49.5% of these people actually noticed that they have actually admitted to having one form of mental health illness or the other, or having had one episode at least. So this is it's like 1 out of 2 teenagers we're talking about here. We're talking about depression, that's our main focus, but mental health basically is out there, okay? And so the family we're going to use today, our patient is Miss Lisa. She's a 13-year-old rambunctious female, loves to just get out there and get stuff done. And in the past few weeks and past few months, and actually a couple of years, she's been very moody. She's been sad. She's been kind of more agitated. She's impatient. She's losing her temper. She's also kind of failing in her grades. She's just generally not doing well. Well, so Lisa has a big brother called Bart. He's 18 years old, and then she has a little sister called Maggie. You have a thumbs up. I love it. I love it. I love it. She has a little sister called Maggie. So this is the family dynamics. We've got Homer is her dad, and of course, Marge is her mom. So they've kind of been confused about what's going on with their daughter over the past few weeks and months. They mostly just kind of thought that, well, maybe it's just, she's a teenager, you know, she's 13, she's going through the changes. Nobody really knows what's going on. So this evening, after having dinner, there was a little bit of a quarrel during the dinner. Of course, Bart was getting on Lisa's nerves, and Lisa kind of just said she was done. She went straight to her room and slammed the door, and then she went to bed, and everyone else went to bed eventually. And after about an hour, Bart knocks on the door. Well, Lisa doesn't respond. He wanted to just come and check in and see how Lisa is doing. And when he opened the door, he found her collapsed on the floor, passed out unconscious with an empty bottle of pills by her left hand. So that is kind of the story, the premise we're going to go with. So we know, obviously, that they called 911 and Lisa was taken to the hospital. So it leaves the parents, Marge and Homer, go to the hospital with Lisa, and Bart is left alone with Maggie to try to explain things to her. Well, he doesn't know what's going on with Miss Lisa. However, at the hospital, Lisa is officially diagnosed with depression. Now, Marge is a little concerned because she remembers when she was young, she kind of had similar symptoms to that. And one of her sisters definitely had symptoms of depression. So she's kind of seen that before, but she didn't think it was going to happen, and not to her baby, Lisa, not at 13, right? However, we're talking about Bart and little Maggie today. So that's your premise, okay? Now, so two kinds of siblings. There's an older sibling of the child who's got the depression and or suicidal thoughts, suicidal behavior, and a younger sibling. We're going to kind of attack it from both ends today. And so siblings, we love them, right? They're our sidekicks, they're our confidants, they're our cheerleaders, they cheer us on all the time, our safety nets, they're our emergency support system, our confidants. Don't tell anyone, please don't tell mom, please don't tell dad. They're also our kind of like checkmates, right? They're like, okay, if you don't take your medicine, I'm gonna tell mom. So siblings are everything to us. And so we love our siblings, and we as siblings love our siblings. However, when you have, and then for the younger siblings, they're also our playmates and they get on our nerves, the usual stuff. But for those of us who maybe have a teenager who's been diagnosed with depression, and we haven't really talked to the siblings about this in the past, Homer and Marge have not talked to Maggie and Bart about this symptoms because they just didn't know what to say. They kind of thought it was just a phase, it's going to pass, and alas, it didn't. So now they're faced with the situation of having to talk to their kids and explain to them. So obviously they're going to have two talks, right? Let me see what people are saying. Hi, Mom. Hi, Gloria. Thank you for writing 49.5. Yes. And we have Shelly White and Felicia Hunter. We have Angel Brumskin, Peace Oscar, Bruce Ferguson, Alonzo Madrid. Thank you guys for joining me today. We're talking about siblings of teenagers who have depression and what to do with them, what to do about them, how to help them. Okay. So needless to say that the siblings, our buddies, Bart and Maggie, are going through some changes at this moment, right? Bart just found his sister passed out on the floor. Lisa passed out on the floor with an empty bottle of pills, and he's all of confused, right? So one of the first emotions that the siblings go through is confusion. What's going on? I mean, I know he kind of had his suspicions. It was like, Lisa has been kind of sad lately. She's no longer much fun to hang out with. Her grades have been slipping, but her passed out on the floor, that's kind of like major, right? So Bart is all of confusion right now. He's also, they can also feel neglected. A lot of the siblings who have been polled do feel kind of neglected because maybe the parents have been paying more attention to Lisa. In the past, they've been having to walk around her like there's eggshells on the floor, and they're just kind of neglected because they feel like everyone has been just talking about Lisa. What about me? What about me? Especially little Maggie. Maggie misses her playmate Lisa. She misses her fun hangout buddy Lisa. What's going on with Lisa? And then sometimes they experience fear, right? Like, is this something that's bad? Is this something is she gonna die? Is she gonna come back home? How is she doing? What's going on? They also feel anger sometimes and resentment sometimes towards the teenager who is sick. So can I have someone please write anger and or resentment? They feel anger and resentment sometimes towards the teen who is sick, mostly because they don't know any better. They don't know what's going on, but they're just feeling like, gosh, it's Lisa again. I mean, come on, what's going on? They might feel frustrated naturally, especially if the child is diagnosed and has been getting some treatment and maybe not getting any better or has had a relapse. They might feel frustrated, right? It makes sense to feel frustrated, like, Lisa, get better already, right? Because a lot of times they think Lisa is doing it on purpose, but really she's not. We know better now that she's not. They feel discouraged Like, maybe they feel like they've done what they can do. They don't know what else to do. They're kind of not sure what's going on. Can someone please write discouraged for me? Hi, Brittany McCracken. Hello, how are you? And then all this will cause for a strained relationship, right? Naturally. I mean, for instance, Bart is 18. He's about to go off to college. He doesn't know what's going on. He's just like, you know what, I'm just forget her. We all know Bart. He has his own little drama, but he's like, forget her. But so that will cause a bit of a strain in the relationship. The siblings do suffer a lot is what I'm trying to say here. All these emotions is a bit much for one person or any two people, really. And of course, we've mentioned that the younger sibling, like Maggie in this case, might feel neglected and start acting out, right? She's trying to get attention. She starts acting out, and she might even mimic the behavior. A lot of the younger siblings might mimic the behavior. Can someone please write mimic? Hi, Felicia Arrington. How are you? Hi, it's my blue baby. Tell her I said hello. Hi, Francesca. Hi, Ram. Shadi, what's up, girl? So yes, so they might actually start mimicking the behavior. Younger siblings are very good at that. She's like, well, if that's what's going to take to get some attention up in here, I'm going to act just like Lisa, because she doesn't know any better. And it doesn't help, like we said, that the parents were confused. Homie and Marge were confused. They didn't really know what to do. They didn't really tell them about it at the beginning. They didn't really discuss it at the beginning because they thought it was a phase that's going to go away. But obviously it didn't. So that being said, and so the things are confusion, the emotions are confusion, exhaustion, fear, anger, frustration, guilt. Guilt is one of them. They feel guilty either because, well, they don't have any illness. And so they're kind of not sure how to act. Like, I'm fine now. So should I feel bad that I don't have any illnesses, or, what's going on? So it's a whole range of emotions. And I find that siblings are unsung heroes where their teenagers are depressed. Siblings are unsung heroes. So let's give them a round of applause, because it's very difficult to deal with this kind of situation where you just don't know what's going on. So what to do? So older sibling, Bart. What do we do about Bart? So I say the first thing, because Bart is 18, I can talk to you directly. My older siblings, if your younger sibling, 13-year-old Lisa, for instance, has been diagnosed with depression, the first thing I want you to do is educate yourself about depression. Find out everything you can about the diagnosis. Read about it, ask questions, learn about it. You're old enough to do that. So find out for yourself, what is this diagnosis that's plaguing my sister? And how can I help, right? But it makes a big difference when you now understand what's going on with your sister. You're able to help her. You're able to know, the ups and downs and the ins and outs of the diagnosis. So first thing I want you to do is educate yourself. So hi, BJ. Hi, Elizabeth. How are you? So someone please write educate yourself. So you want to educate yourself about the diagnosis. Is a major deal for me. And the second thing you want to do is separate the sibling from the behavior. So Lisa is actually not doing it on purpose. Now that you know, right? Separate the behavior from Lisa. Your sister, Lisa, the one you knew that used to act, she was very rambunctious, she had all the energy in the world. Try to separate that new behavior, that diagnosis of depression from Lisa. And then maybe you'll be able to manage the depression separately, okay? The other thing you can do is, we already talked about understanding, is let go of any expectations. Like, don't say, well, Lisa, you're 13, I expect you to get better because the book says get better. No, none of that. Learn about it, and that's it. Educate yourself, arm yourself, but don't make any expectations, because we don't know exactly what her diagnosis is gonna do. A lot of people get better. The truth about depression is they do get better. It's treatable, they do get better, but also they do relapse a lot. And so the first thing that Lisa wants from you is understanding, obviously caring, learning about it, but also don't expect her to get better faster or get better within 6 months or whatever it is that you're thinking in your mind. And then of course, since you're 18, Bart, we're gonna ask you to also take care of yourself. Don't lose yourself in the midst of things in there. And take care of yourself, I also mean, look for symptoms in yourself. A lot of times, depression does run in the family. We talked about the fact that Marge had remembered that one of her sisters was diagnosed with depression when they were young, right? So it does run in the family sometimes. So I would say, look for the symptoms in yourself as well. Okay. Now, when it comes to your baby sister, Maggie, so for the younger sister, younger sibling, what do we do? What do we do? So for parents out there, I think my first and most important advice is it's okay to not know what to do. It's okay to say to yourself, I don't know what's going on. I want to know what's going on. It's okay to not assume that is something and you can handle it. Sometimes it's okay to say, I don't know. I don't know. But let's figure it out and let's find out how to help your sister Lisa. So it's okay to say that. The second thing is you want to plan how to make that explanation, how to explain to little Maggie. Depending on her level of understanding, depending on her age, you know your child. Is she more of a talker? Is she more of a quiet, reserved one? What kind of child is she? And then you can figure out how to engage, how to tell her about it. You may want to play games, maybe. You might kind of make a story up or tell a story. Whatever your child is going to understand. Since Maggie in the story is 6 years old, let's have her kind of like, maybe get her a book, get her resources, get her little videos. Find something, some kind of resource that can help you introduce the speech, introduce the talk. Don't make it too long because she can't really understand if you take too long. Excuse me. But certainly you want to make sure that you engage with her at her age level, okay? So you want to use appropriate words that she will understand. You want to provide resources. You want to explore it together. Like you can say, so I don't know exactly what's going on, but we can find out together. Take her to the library, take her to the bookstore. You want to make out time to spend with each sibling, right? As a parent, you want to make out time to spend with each sibling. If the younger sibling is beginning to mimic the behavior, like we said, because she's feeling maybe a bit ignored or a bit underappreciated, so to say, you want to spend more time with her, okay? And then you want to teach her empathy, you want to teach her compassion, you want to teach her to express her love through ways that she can, like maybe draw pictures for Lisa, maybe write a little note for Lisa, maybe buy a little toy for Lisa, just something to make her understand that Lisa is sick right now and we're here to support her, okay? So, and parents, be honest with yourself. Sometimes we just don't know what's going on with our kids and it's okay to be honest, okay? Let me see. If the younger sibling is maybe between 8 and 10 and can understand some things already, she or he might have some misconceptions. So you want to have that talk with her and kind of explore what does she know already and then correct her misconceptions if you can. Otherwise, there's me, right? There's your pediatrician. There are lots of resources out there. There are counselors, there are therapists, and stuff like that. So one thing that I noticed when I was doing my research that was very, very exciting was there's an app for that. This app is called Not Okay. It's Not Okay. And I actually found it and I downloaded it yesterday. It was made by 2 siblings. The sister was, I think, 14 or 15 when she had depression. And then her brother is like a techie. And together they made this app. It's called Not Okay. I love it because I was able to download it yesterday. Basically what happens is when the teenager, this is for the teen who's depressed now, is going through those negative thoughts and having those negative feelings, she has 5 contacts. She types, "Not okay, please find me or text me." Something like that. I just love that. So someone please write "Not Okay" for me. I thought that was really, really neat. And so this is an app that's free to download. When it came on a couple of years ago, it was $2.99, but they've had sponsors since then, and it's free to download. It's a Not Okay app. And this is for the child who's depressed to text 5 contacts that they know and trust and say, "Hey, I'm not feeling okay. Please call me, text me, come and find me." And what the app does, which is really neat, is it finds the GPS location of the teen so you can reach them. I thought that was so much fun. So yes, I say go ahead, download the apps, parents. Download the apps, teens. It's called Not Okay. So advanced moves. What other things can you do as a parent for your siblings, as a teenager who has a sibling who's sick, or as a child who has a sibling who is sick? Okay, so counseling, we talked about that earlier in a sense. You want to consult your doctor, call me, huh? Or just find a therapist or a counselor out there. There will be family therapy sessions, there will be group sessions, there will be individual sessions. One thing I noticed, I did have a son who, I do have a son who was bullied and was depressed when he was young. One thing I know that I did when we're kind of going through that was I signed up his siblings to have counseling with him. So we had a sibling counseling session. Do you know that to this date, those children tell me that that was one of the best and funnest things that they ever did. It helped them kind of talk to a counselor one-on-one and actually kind of go through what they knew, what they didn't know. They just enjoyed it so much. So yes, I say counseling, counseling, counseling. Talk therapy, right? So sign up for sibling counseling. Parents, sign up your kids for sibling counseling. Sign up for family counseling, individual counseling for the siblings, whichever one works, okay? So the key is the age. The key is the age of the child, age of the sibling. An older sibling can usually maybe need less nurturing when it comes to dealing with their sibling who has depression, and a younger sibling might need more nurturing, but it just depends on the age. So parents, remember, our siblings, the siblings of the teens are the unsung heroes sometimes. So we need to lift them up and help them deal with this sibling who is depressed. Let me see what else. So encourage some family activities. If there's any activities that you like to do together, for instance, maybe, I don't know, going to Fiesta Texas, playing family games, playing board games, drawing pictures, going to one of those painting places. Just find some kind of activities. I'm an outdoor kind of person, so I like to go outdoors. I'll go to the Greenway for a walk, just something outside. I love that. That's me personally. You can ride bicycles together, just do stuff together to help us bond together, because the stronger the family is together, the better we can handle this. Tell the siblings of your teen who is depressed that depression is treatable. It is manageable. I wouldn't use the word curable, but certainly it is treatable. And a lot of times as they get older, they do discover that suicide is not the option. It is a permanent option for a largely temporary problem. So the more we engage the teen themselves and their siblings, the better for us all. Have an open door policy. I like that. When I was in the military, we always had an open door policy. So just leave the door open, so to say, virtually speaking, so that the siblings have easy access to you whenever they have questions or concerns. Hug on them, love on them, and just kind of help them through, okay? And eventually, I think the last thing I have here is just help them feel connected. They can send cards, they can write letters, they can draw pictures, they can buy toys, whatever your teenager likes, the siblings can find ways to connect with them. So that is all I have for you. It's 2:23. I try to stay on the 20 minutes today, but I kind of got excited a little bit. So that is all I have for you today. If you just joined me towards the end, we were talking about how to handle siblings of teenagers who are depressed. Thank you guys so much for joining me as usual. Thank you for all the love. Wow. As usual, if you found this video helpful in any which way, please share, tag your friends, tell them about me. Every Sunday at 2 p.m. it's time for Ask Dr. Lulu. I will see you guys next Sunday, where we're going to talk about something else fun that has to do with teenagers. In the meantime, excitement. I have my website, teenalive.com, launching tomorrow. We had some technical difficulties over the weekend, so we couldn't really launch as we wanted, but I had to go visit my little eaglet in school, so I kind of had to do that first. But tomorrow we're gonna launch. I'm excited, super excited. teenalive.com, write it down, remember it. It's gonna be a lot of fun. I look forward to hanging out with you guys and signing you guys up for your parent coaching and your teen coaching and your public speaking engagements. So let me know if you need any of those, okay? Thank you so much as always. I'll see you guys next Sunday. Peace.